beautiful people, welcome back to the channel. My name is Princess Kelvin. If it's the first time of you seeing this beautiful face, you are welcome. But if you're a returning viewer, you're a returning subscriber, thank you so much for always tuning in and always clicking on my videos. So for those of you that don't know, I'm a nurse and I'm going to be doing a nursing related content today because normally the channel is about nursing, about my lifestyle and faith in general. So but today's video is about nursing specialties, and we're going to be talking about the specialties in nursing where someone can specialize, and for different reasons. I'll talk about the reasons why someone should specialize in a particular area of nursing. Alright, so let's get into it. Nursing specialty is an area of nursing where someone can decide to gain more experience in, so that person can practice specifically in that particular area of nursing. So basically how it works is that after your nursing school and getting a degree in nursing and you're a registered nurse, you're a certified registered nurse, you can decide to go back to school to gain more experience in a particular area of nursing, just so that you will focus on that area in your career and you're not a general nurse, you get. So that is what it entails. So why do people normally specialize? I'll say there are different reasons why someone can decide to specialize. It could be for money, more money obviously, and it could be for they just like that particular area. And then another thing is that it gives that particular nurse, it's not that specializes, it gives them an upper hand because they are no longer seen as a general nurse. So for instance, someone that specializes as a renal nurse, the person will most likely be employed as a renal nurse, you get. So the person might not go to work in ICU or go and work in as a pediatric nurse because the person has specialized in renal nursing. And then as the person has specialized in renal nursing, the amount of money they're supposed to pay, because there's always a range of payment that they can pay different specialties. So the amount of money they're supposed to pay a renal nurse will be what that person will receive, yet. So now let's dive into the different areas or different specialties in nursing. So the first one that is quite interesting is ICU nurses. You can also call them critical care nurses. So what they do basically is that they work in intensive care. They deal with very, very, very critical patients. So if you're someone that can work under pressure, yeah, that's the word, you can work under pressure, you can decide to check out ICU nursing or critical care nursing and see if it's something that you can be willing or you're willing to go into. What ICU nurses do most times is holistic nursing care. So when I say holistic nursing care, I just mean every nursing care is what they give to the patients, from bed baths to medications to vital monitoring, because most times since they are critical, they are mostly connected to monitors, and the monitors is always checking their BP, so you have to just constantly check the monitors and note and be sure that everything is in order. They are also the nurses are also monitoring the ventilators, the infusion pumps and all. So just a lot. So but if you're an active person, because there are some people that they don't like working in a calm environment, they want to work in an active environment, you can decide to give critical care nursing a chance. So yeah, that's the first one. The second one I will talk about is pediatric nursing. So this set of nurses, they take care of children, they treat children, and they take care of children. So basically they are working in a pediatric. You can work in a pediatrics hospital, you can work in a pediatrics unit. Another interesting part is that you have to always communicate to the parents what is going on, and then most times these parents are on edge, so you have to find a way, you have to know how to talk to the parents so that they will understand you, and then they will be calm in a way, because obviously if their child is not getting better, they can tend to be aggressive and you will not blame them. So yeah, that's just one of the technical parts about pediatrics nursing. So if you love children and it's something that you know you can handle, you can decide to give pediatrics nursing a chance. So the next one is oncology nursing or oncology nurses. These are people that treat cancer patients. They mostly deal with cancer patients. So what they normally do is that they are always monitoring the chemotherapy, and they always deal with chemotherapy, and then the side effects of chemotherapy, obviously just trying to manage it in the patient and all. And then another important thing is that they have to have they have to give emotional support to the patients, because cancer is a very very, what is the word I'll use now, a very very unique, very very unique field, or a very very unique disease. So dealing with cancer patients, you have to be emotionally available for your patients, and always talk to them and reassure them and tell them the truth on how the process of the treatment is going. So that's one thing that oncology nurses normally deal with. So another thing is that they might, in the end, it's just a sad reality that might happen. In the end, they will have to give sometimes um end of life care to the patients. So because most sometimes some of the patients might not really survive, and then treating them while they are dead, or taking care of them while they are dead, is another aspect of oncology nursing that people should know about. So if it's something that you can do, and most times people that decide to do oncology nursing, they feel like it's a calling in a way. So if it's something that you're interested in, and you can go ahead and research and make your inquiries, and go ahead and study it, so that you can have it as a specialty in nursing. So the next specialty we're talking about is nurse anesthetics. And these people, they are those that work in surgical areas. Nurses that work in surgical areas, they give anesthesia, and then they monitor the patient that receives the anesthesia, and just monitor their vitals, make sure they are breathing while they are asleep, like while they are unconscious, and make sure that everything is just normal, their BP, their pulse, their what again, respiration, and other things are normal while they are unconscious. And also during the recovery, when they are coming back to consciousness, sometimes they might be totally unconscious. So during that whole process, the nurse has to make sure that they are okay. So that's basically what they do. They work in surgical areas, and mostly in theaters and all. And most times people's like, yes, the statistics shows that these people are highly paid. Like nurse anesthetists that are one of the highly paid specialties in nursing. Between that and flight nurse, because flight nurse, they are paid highly, but nurse anesthetics and flight nurse, they are up there in the charts among those that are highly paid. Now let's go over to travel nurse. I'll still mention flight nurse. I'll still tell you guys what flight nurses do. But then let's go over to travel nurse first. Travel nurses are nurses that take jobs, or take minor nursing projects or nursing jobs in different areas of the country, or different areas of the world. It can be international, or it can be national, depending on how the person is working, or how the nurse is working. So they just take smaller nursing projects in different places. So they might have to travel to a country and stay there for, it depends on their contract, it depends on how they are working with the organization they are working with. So it depends on how what the contract says. So they may stay there for 3 months or so, and then after that they are done with their contract, and then they move over to another place. Let's go over to flight nurses. Flight nurses are people that are within the aircraft. Most times they are within the plane and within the aircraft, just to make sure that there's no casualty, or there's no emergency unattended to in the plane. So now, if obviously as the plane is going on, if there's an emergency, a flight nurse can be there to attend to the patient, and maybe stabilize the patient till they get landed. You get that? Just basically what they do. It's not really complex, but depends. It could be complex depending on the case they have that day. You get. So yeah, that is what flight nurses. That is different between flight nurses and travel nurses. So the next one we're going to be talking about is public health nurses. So public health nurses are those that work in communities. So if you want to help patients in a larger scale. Public health nursing can be something that you can decide to go into, because public health nurses, what they do is that they create awareness, they run vaccination clubs, vaccination areas in the community, and then they just teach the community and the community people. So it's something like they give treatments on a large scale rather than from one patient to another. So if you want to help people on a larger scale, I feel like public health nursing is one area that you could venture into. So the goal is they are trying to prevent, they could be trying to prevent an outbreak in the community. Even if maybe one person might be ill of a particular disease, they will isolate the person, stuff like that, just so that the whole community will not end up being affected by that person. I'll have to end the video here, guys. Thank you so much for watching. Stay tuned for the second part, which will be coming up on Friday. Bye.